Motivating a plan member or for that matter, a patient to take the next best action is not easy. But to do that in a way that's both empathetic and very personalized is even harder. That's why I'm excited to sit down with my next guest to dive into how they are achieving that at scale for a lot of plans. Meeting with me will be Chandra Osborn, and she's the Chief Experience Officer at AdhereHealth. I love speaking with Chandra because she knows a lot about behavior economics and behavior science. And I was really interested to ask her about some specific examples of how their technology and how their service is really helping plan members. You're really going to love the example that she gives about how they helped one particular plan member deal with a lot of things that were happening in her life in order to keep her on top of her medication, and the difference that that made for both the payer as well as for that plan member. Let's get to it. Chandra, welcome back to the program.
Thank you for having me.
It's been a while since we last got together, but I'm always excited to speak with you because you're in such an interesting area and you're applying such a unique approach to motivating patient behavior. But before we get there, Chandra, can you just, for the benefit of our audience, introduce yourself again and the organization and tell me a little bit more about AdhereHealth?
Sure. I'm Chandra Osborn, Chief Experience Officer at AdhereHealth. We support Medicare Advantage plans with engaging their members to promote medication adherence, close care gaps, promote patient safety, and a variety of other ways that health plans need our support.
Chandra, so let's get right into that part of it. What are some of the ways that you're helping people stick with their medication?
Well, every approach has to be personal, and personalization is key. That's the world we live in now, and that's really how human beings behave. So with each member, we use a unique recipe to be able to create trust, to be able to engage them, and to understand what's in the way of their success.
And what do you find often is the case in terms of what the barriers are to them sticking with the plans that are given to them?
Yeah, it's a great question. So there's a widely held misconception that the reason why people don't take their medications is because they forget or they really don't care about their health. The reality is there's over 30 reasons and more why people don't take their medications. And that gets very personal based on the characteristics of the person, their life circumstances, all these different variables. And so when we connect with a member, we identify what their specific issue is that's interfering with their success, their barrier. Sometimes it's one, oftentimes it's multiple. These things get stacked and they change over time. We're talking cost, we're talking access, we're talking life stressors, we're talking misunderstanding of their health condition and the importance of taking a medication, side effects. Maybe they've heard that the medication causes more harm than good based on a family member who's taken it. So it really runs the gamut of the types of things that interfere with a member being adherent.
Chandra, can you give me any examples or specific examples of how you help patients get through this?
Yeah, for sure. So I'll give you one of many examples we have. There was a member that we were supporting last year in 2025. She's in her 60s, she has diabetes, hypertension, high cholesterol. We partnered with her health plan. The health plan reached out to her to introduce her to who we are. So already there, we're trying to create some trust with the member. We noticed based on our data and our predictive analytics that we have that she didn't pick up her medication. So we prioritized her for outreach, and our first attempt was to send her a text message reminder. That didn't work. Clearly, being reminded wasn't the barrier that she needed addressing. So we had our clinical team outreach to her and learned that through empathetic listening, motivational interviewing, building rapport, we learned that she was forgetting because she was taking care of her elderly mother. She was prioritizing her health before her own. She also didn't sort of fully understand if her medications were working, because for her chronic conditions, they're silent. And so she sort of didn't understand the benefits. And so our clinical care team connected the benefits to her by saying, hey, you take your medications, you're going to be a better caregiver for your mother. And also, too, let's make it easier to get your medication. So we're going to coordinate with your pharmacy, get you auto refills and 90-day scripts. And so that way, this is just easier for you to do. And we send her on her way. We not only communicate with the member once, we're on the hook for the entire plan year. So we noticed she missed a fill again. We contacted her. We learned that her mother was getting more sick. We also learned that she wasn't working as much to care for her mother. So cost was a concern. Food was a concern. Transportation to the pharmacy, leaving her mom, was a concern. So what did we do? We addressed all of those barriers by connecting her with a local food bank, by providing financial assistance guidance, by creating a mail order delivery to her home with her pharmacy. So now we had to address all of those barriers. And then later in the plan year, we learned that she was delayed in getting her medications again. And so we reached out to her prescriber and said, hey, when you connect with this patient, will you please reinforce what we've done? See if there's other things going on, because we recognize, a member's prescriber is a huge influence, and often a positive one. And so we wanted to orchestrate that. And as a result of all of this effort, using behavioral science, using different channels, coordinating with stakeholders, this member actually ended the year a success. She, and success, according to Medicare Advantage plan, is achieving at or above 80% of the proportion of days covered of your medications for the year. And she actually achieved that. So that's one of many members in a plan population that we're addressing, and we're doing it all very personal for each one. And what that looks like at the population level, so the plan that this member came from, we actually increased the proportion of days covered in this plan by 15% than the previous year. So in their high-risk population, we improved the adherence rate by 15%. And of those members we engaged with, we intervened with successfully, they were 33% more likely to end the year adherent than those we did not. And so this recipe works.
Well, Chandra, this sounds amazing. I mean, who wouldn't want personalized, bespoke care with someone who's empathetic, listening, and then catering to the specific needs that this individual has? But I have to ask, what's the incentive to do this? Is there some financial benefit to doing this? I mean, obviously there must be, otherwise you wouldn't be hired to do it. So can you tell me about that?
There is an incentive for the health plan. We support their success because when members stay healthy, when they get the care they need, they take the medications they need, there's benefit to the plan. And so their ratings go up, more members want to participate in the plan, and also they're incentivized by CMS. So they get bonus payments in order to keep their population in good standing.
Right. So basically out of the ER, right?
That's
and
right.
Out of higher cost care.
Yes.
So, and I'm glad you brought up the whole score and patient engagement scores, because that is an ancillary benefit to them to say, hey, when we're, excuse me, when we're taking care of our patients, when we're taking care, of our plan members, that filters into higher scores.
That's right.
So at the highest level, when you talk about the population, what, if this is deployed properly, what are some of the, I'll call it, industry benefits that you could see for us if we do this right broadly?
Yes. Well, there's a lot of, more near-term impact, as I said, with bonus payments for star ratings for the plan, but there's huge benefits for the members. They're getting healthier. Costs are going down. So, the plan is saving costs, the member is saving costs. We also are moving towards, in the STARS framework, a more healthy outcomes, being incentivized for that. That's big for the current administration. And so we're going to be able to drive that because adherence is one of the strongest predictors of clinical outcomes, not only stabilizing health, but actually preventing progression of disease. And that's going to be, I think, more heavily weighted as we evolve into a more health outcomes-based STARS framework.
So at the top, you mentioned that you have to get to know the members and you have to understand their needs. How does that happen in terms of getting to understand their specific situations? Is it just ad hoc as they call in, or is there something else that happens?
So we give them the option to call in. We contact them by phone. We also contact their doctors through the EHR. We text message them. We're about to launch digital feeds. There's all these channels that we use to get a hold of the member. And then we use an evidence-based approach to rooted in behavioral science, which is called motivational interviewing. So oftentimes a member might be skeptical. Who are you? Why is my health plan calling me? And so we have to, roll with that resistance. And we have to build rapport with the member. We have to use a lot of active listening. We have to be very gentle. A lot of times, once we use those approaches, these members really open up because many of them are lonely. They want to talk to someone. And so we use our different techniques in order to build that trust, open that channel of communication. And what's interesting, oftentimes, then the members do call us back when they need help once we've established that foundational relationship.
Chandra, if I was a plan executive standing in front of you, what would you say to convince me that AdhereHealth might be something I should be thinking about?
Yeah, well, currently, a lot of people are thinking about AI, and we haven't even said the word in this conversation. And what I would say when it comes to AI, which is top of mind for so many folks, is that it can identify the problem. It can also help us prioritize who to connect with. It can also point us to what the next best action is. But it is best served currently when you have human connection, clinical expertise, behavioral science, and coordination between the member, their health plan, their provider, their pharmacy, these key players. And we provide all of that. And I think that's a really robust recipe as we continue to move further into the AI space, where we continue to champion all those other aspects that are critical to engaging Medicare Advantage members.
Chandra, is there anything that's exciting that's happening in the world of behavior science or behavior economics applied to healthcare that you're excited about?
Yeah, one of the things I'm most excited about when it comes to behavioral economics and behavioral science is the blending of the two. There's a big debate in the behavioral science community on what's more important, nudges or behavior change techniques. From the behavioral economics camp and the behavioral science camp. My answer as a full stack behavioral scientist that uses both is that it depends on the problem you're solving. If it's a simple behavior, nudges come in handy. If you're dealing with something super complex like medication adherence in an aging population, we use these behavior change techniques. And sometimes we have to use both. So we use nudging to engage the member in talking to us, right? To get them to pick up the phone or to reply to the text message. Those are simple behaviors. But when we really want to move the needle and move the mountains that are in the way for the member, we got to use the big ingredients. And so what I'm really excited about is how nudges, behavior change techniques, and AI are all coming together to really spin up the right recipe for the right person at the right time for the right problem.
Chandra, where can people go to learn more about AdhereHealth?
Yeah, you can find us on AdhereHealth.com.
Excellent. Well, Chandra, thank you so much for agreeing to come on camera again, and it's been a pleasure speaking with you.
Likewise. Thanks again for having me.
Hey, I really want to thank Chandra for hopping on camera with me. It's always a lot of fun to speak with her. I really appreciated that example that they gave of how personalized and how much empathy and how much they understood of that one plan member's situation and were able to give her the right supports in order to keep her on her medication regimen, therefore keeping her out of the more expensive forms of care. Everyone wins in this equation: the payer, the plan member, and of course, AdhereHealth, because they were the ones that were applying behavior science, behavior economics, and behavior change to make sure that that person stayed right where they needed to be. And hey, if you made it this far in the video, we really appreciate it if you mash that like button and click subscribe. Also, head over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.